IPGA. Welcome.
Uh, Actually, today my topic is diuretics. I'll make the slides ready first, then
Okay,
you
sir.
can move.
Thank you, sir. Thank you.
Thank you.
Good morning, everyone. We welcome you for the GPAT classes for today. Today we have the first speaker, Dr. Muralidharan, who is the professor of the Department of Pharmacology, Seal-Bagnath College of Pharmacy in Chennai. So he completed his bachelor's and master's degree from JSS College of Pharmacy in UT, and he completed his Ph.D. in pharmacy from Meenakshi Medical University. He has close to over 20 years of teaching experience, and he has been awarded a best teacher by the Tamil Nadu Penjar Medical University. And he has a wide range of publications from national journals, international journals, and he has also published 3 books. So he has huge experience. I think he's going to help you in getting things right for you in your GPAT exams. Sir, you can start your presentation, sir.
Okay. Good morning, everybody. Today, I take a special privilege to thank the IPA for the persons who are organizing this GPAT coaching. Really, it is a wonderful thing for the students. And my topic is diuretic agents, and I wish all the participants good time for the GPR preparations. And diuretic agents, I will straight away go to the topic. And diuretic agents are nothing but these are the drugs which are used to accelerate the rate of urine formation. That is, more volume of urine has to be collected. Then we have to use this drugs. And result of this drug when we use mostly is removal of sodium ion as well as water. That is, whenever a sodium ion is taken out, a water ion also passes out. That is the way this diuretic agent acts. Next slide, sir. So next slide. Not this one, the previous one. Yes. So previous one, next one. So where sodium goes, water also follows it. And so 20 to 25% of all sodium is getting reabsorbed into the bloodstream by the loop of Henle. That is the part of the kidney, and 5 to 10% in the distal tubules and 3% in the collecting ducts. So if water is not absorbed, it is excreted as urine. So once the water gets reabsorbed, the sodium ion also gets into our stream. So if it is not absorbed, we lose sodium also. Next one, sir.
Yes, sir.
So this is a typical picture which shows the functions of the parts of the kidney. And if you can see the afferent arterioles or the glomerulus is seen in the top corner. Then the proximal tubule, then the descending loop of Henle is there, ascending loop of Henle is there, distal tubule is there, collecting duct is also there. And coming to that next one, sir, the nephrons and the diuretic sites of ADH is being seen in this picture. You can change the next one. So the diuretic agents, as we say, is of 5 types, that is carbonic anhydrase inhibitors, loop diuretics, osmotic diuretics, then potassium sparing diuretics, thiazide and thiazide like diuretics. Next one, sir. This is the classification of the diuretic agents used. And coming to the carbonic anhydrase inhibitors, the drugs are acetazolamide, methazolamide, and dichlorphenamide. Next one, sir. So these drugs come under the classification carbonic anhydrase inhibitors. Next one, next slide, please, sir. So first, we may go into the mechanism of carbonic inhibitors. Previous slide, sir. And the enzyme carboanhydrase is responsible to make the hydrogen ions, which is available for exchange with sodium and water in the proximal tubules. So here, when you do this acetazolamide or any other drug, which is a blocker, this carbonic anhydrase inhibitors will block the actions of carbonic anhydrase, which that is the enzyme which is responsible for the proton ions, which prevents the exchange of sodium ions with sodium and water. Next slide, sir. So the inhibition of carbonic anhydrase will reduce the proton ion concentration in the renal tubules, and the result, there is an increased excretion of bicarbonates and sodium as well as water and potassium. And because of the proton decrease, the reabsorption of water is also decreased, and urine volume is increased. So that is the mechanism behind this carbonic anhydrase inhibitors. Next one, sir. So the carbonic inhibitors are indications where it can be used as adjuvant agents in the long-term management of open angle glaucoma. Mostly these carbonic anhydrase inhibitors are being used for open angle glaucoma in the eye treatment, and used in with myotics to lower the intraocular pressure before the ocular surgery. That is in the eyes. This drug has to be given earlier to produce a reduced intraocular pressure for ocular surgery. And these drugs are also useful for the treatment of glaucoma, edema, epilepsy, and high altitude sickness. Next, sir. So acetazolamide is mainly used in the management of edema, secondary to heart failure. In the heart failure, the edema is accumulated in the cardiac muscles, and when other diuretics are not effective, carbonic anhydrase inhibitors plays a major role. And this carbohydrate inhibitors are less potent diuretics than loop diuretics or thiazides, and the metabolic acidosis they reduces the diuretic effect in 2 to 4 days. So for the first 2 or 3 days, these drugs are very effective, and after that, they are reducing their diuretic effect because of acidosis. Next slide, sir. And this carbonic anhydrase inhibitors, they themselves have many side effects like metabolic acidosis, anorexia, hematuria, photosensitivity. Once the patient takes this drug, it also induces photosensitivity reactions like and in diabetic patients, this can elevate the blood glucose level, rosiness level, and paresthesia, urticaria, and melena are the common side effects of this drug. Next slide, sir. Then about the loop diuretics, here these diuretics are very important because they are the powerful diuretics which are being used. It acts on the loop of Henle, and that's why it is called as loop diuretics. Drugs are bumetanide, then ethacrynic acid, then furosemide. The persons here, you must keep in mind that furosemide is a drug which is now available in the market, as well as ethacrynic acid is also there, but furosemide is a potent diuretic. This acts on the loop of Henle. Next slide, sir. First, we'll directly go to the mechanism of action. This drug, as it is told as loop diuretics, they act directly on the ascending limb of the loop of Henle to inhibit sodium and chloride reabsorption. So the loop of Henle is the main area where this reabsorption takes place. So it will directly act on the ascending limb, and it will inhibit sodium and chloride reabsorption, because we know that Whenever a sodium molecule is being taken inside, water also is taken inside. So this drug will act on the ascending limb of the kidney, and it increases the renal prostaglandin levels, which is resulting in the dilation of blood vessels. Prostaglandins are inflammatory markers, and also they also produce um, vasodilation. So whenever we give this drug, there is a vasodilation in the renal glands, and because of that, more bloods will be pumped inside, and it also produces reduced peripheral vascular resistance to the um, absorption. Okay, next slide, sir. So this potent diuretic, they are potent diuretics, and it produces diuresis and subsequent loss of fluid, and decreased fluid volume will produce reduced blood pressure, and it can reduce the pulmonary vascular resistance, reduce systemic vascular resistance, and also the central venous pressure, and reduce left ventricular and diastolic pressure, as well as potassium depletion. Next slide, sir. And this loop diuretics, they are mainly used to remove the edema which has been formed due to heart failure or hepatic or renal diseases. So whenever there is a damage in the heart or liver or in the kidney, it produces edema. So those types of edema which is accumulated in edema is nothing but accumulation of more volume of water in our body due to any inflammation. It produces inflammation and pain. So to remove that, these drugs are very useful, and this also can be used as a drug along with antihypertensive drugs like propranolol or beta blockers or calcium channel blockers to control hypertension. This alone cannot be used as antihypertensive drugs, and it also increases the renal excretion of calcium in patients with hypercalcemia. Wherever the volume of calcium is high, when you give this drug, this will increase the renal excretion of calcium in the patients, and it is useful whenever there is rapid diuresis is deserved. Whenever you feel that more volume of water has to be taken out from our body, this loop diuretic helps that, because it produces a rapid onset of action. That is, a faster action is felt. Next slide, sir. So it also has its own side effects. On the CNS, it produces dizziness, headache, tinnitus. Tinnitus, you may know already. It is ringing sound in the ears, and then blurred vision is all there in the CNS. And in the GIT, it can produce nausea, vomiting, and diarrhea. These are all the common symptoms or side effects of many drugs when it is in the GIT. Okay, next slide, sir. And about the body system side effects, hematologically, it can produce neutropenia, thrombocytopenia, agranulocytosis. And in metabolic side, it can produce hyperuricemia, hyperglycemia, hypokalemia, or the side effects produced in the metabolic side. Next slide, sir. On the osmotic diuretics, this is based on the osmosis principle, and it is mannitol. Next slide, sir. On the mechanism
So, excuse me, so a little bit audibility is lesser, sir. The voice, can you please raise or voice?
Volume is
volume of your voice is lesser, sir. Please, thank you.
Okay, definitely.
Excellent presentation. We just want to little bit of audibility. Thank you, sir. Thank
Audible.
you, sir.
Okay, okay. Now it's audible.
Yes, sir.
Yes,
Certainly.
sir.
Thank you, sir. Thank
Okay.
you. Thank you.
Okay, about osmotic diuretics, first we'll see on the mechanism. These drugs work in the proximal tubule and non-absorbance, producing an osmotic effect. and it pulls water into the blood vessels and nephrons from the surrounding tissues. Like osmotics, what is osmosis? Whenever we are putting um, porous membrane, when you are putting or a porous membrane and you are putting two compartments, one compartment filled with high concentration and the other with no concentration. What happens? This high concentration drug gets diffuses in its own and it passes through the porous membrane and it reaches the next side of the membrane where there is less concentration or no concentration at all. The same mechanism works here. So once you are giving an osmotic diuretic like mannitol, when the concentration is increased, it gets collected in the proximal tubule and it produces an osmotic effect. So because of that, pulling of water into the blood vessels and nephrons from the surrounding area occurs. Next slide, sir. And it produces reduced cellular edema because of this use of mannitol, and increased urine production is also there, which causes diuresis, and rapid excretion of water, sodium, and other electrolytes, as well as excretion of toxic substances in the kidney also can be done by the use of this mannitol. And reduced excessive intraocular pressure in the eyes is also felt when we are using this mannitol, which is an osmotic diuretic. Next slide, sir. And osmotic diuretics indication. This one is also used in the treatment of patients with in the early or oleric phase of the article refractive stage and to promote the excretion of toxic substance. So this diuretic is mainly used to remove the excretion of toxic substance taken accidentally. That is like a person who has taken mercury poisoning. He will be given antidote, but that will not take the volume of mercury which has been absorbed in our body. So to make it, what they will do, they will give this mannitol also along with that. So what happens? The free mercury gets detoxified, but the absorbed mercury comes out very fastly because of this osmotic action. And this one is mainly used to promote the excretion of toxic substance and reduction of intracranial pressure. And it is also used for the treatment of cerebral edema. What is cerebral edema? In other words, it is called as meningitis, which produces edema in the brain. So to prevent that also, this cerebral edema is osmotic diuretic is being used. Next slide, sir. And it has its own side effects. It can produce convulsions, thrombolysis, and pulmonary congestion is also possible. And it also produces headache, chest pains, tachycardia, blurred vision, chills, and fever. These are the main side effects of usage of osmotic diuretics. Next slide, sir. And about potassium sparing diuretics, it is amiloride, spironolactone, triamantrin. These are particularly used for sparing the potassium. That is, potassium will not be eliminated from the urine. More volume of potassium will not be eliminated. That is the main use of this drug. Next slide, sir. And working mechanism. It works in collecting ducts and distal convoluted tubules, where it interferes with the sodium potassium exchange. Usually, whenever a sodium is getting depleted, potassium also gets exchanged. So here it will interfere with the sodium potassium exchange and it will competitively bind to the aldosterone receptors. So this aldosterone receptors, when it is blocked or when it is binded to the aldosterone receptors, or it will block the reabsorption of sodium water, usually induced by aldosterone enzyme receptors. So here it binds to that, and it blocks the reabsorption of sodium which is next slide, sir. So it also prevents potassium from being pumped into the tubule, and it prevents its secretion, and it competitively blocks the aldosterone receptor, and it inhibits action. So the aldosterone receptors are responsible for the exchange of sodium as well as potassium ions. And when you give this spironolactone, that is a potassium sparing diuretic, it blocks the aldosterone receptor and it will inhibit interaction. The excretion of sodium and water will be promoted without the loss of potassium. That is the important. And then spironolactone indications. There's trimetrin. It is used for hyperaldosteronism and to reduce hypertension and to reverse the potassium loss, which is caused by potassium losing drugs. And amiloride is used mainly for the treatment of heart failure. Next slide, sir. And on the effects of other systems like CNS, it produces dizziness, headache, and in the gastrointestinal tract, it can produce cramps, nausea, vomiting, and diarrhea. And other things like urinary frequency, weakness, hyperkalemia is also felt. And spironolactone, it can side effects, it can produce gynecomastia, amenorrhea, irregular menstrual times, and postmenopausal bleeding is also there when you use this spironolactone. Next slide, sir. And then about thiazide and thiazide-like diuretics. Here, thiazide diuretics is hydrochlorothiazide and chlorothiazide, dichloromethazide. These are the thiazide diuretics, and chlorthalidone and metazolone are thiazide-like diuretics. Okay, next one. About the mechanism, it will inhibit the tubular reabsorption of sodium and chloride ions, and actions it's mainly on the ascending loop of Henle and the early distal tubule, which results in water, sodium, and chloride are getting excreted. So the action is on the ascending lobe of Henle and the distal tubule. Potassium is also excreted to a lesser extent only when you are using thiazide diuretics. And it also dilates the arterioles by direct relaxation of the arterial vessels. Next slide, sir. And drug effects, it can produce low peripheral vascular resistance as well as depletion of sodium and water. Next slide, sir. These drugs are mainly used for along with antihypertensive drugs. So it is used for reduction in the tension, hypertension, or blood pressure. And then edematous status. Wherever there is more edema or accumulated due to some injury or anything, these drugs can be given. And idiopathic hypercalciuria and diabetes insipidus also. And it acts as an adjuvant treatment agent in the treatment of heart failure and hepatic cirrhosis, that is liver bulging because of liver edema. Okay. And then in the CNS, it has its own side effects. As other diuretics, it also produces dizziness, headache, blurred vision, paresthesia, decreased libido, that is decreased sexual desire. And GIT, it produces anorexia, nausea, vomiting, and diarrhea. Next slide, sir. And in the genitourinary area, it produces impotence, and integumentary, it can produce urticaria, photosensitivity, and metabolic disorder area, it can produce hypokalemia, glycosuria, hyperglycemia are the main side effects. Next slide, sir. And then this is another important part where that was all about diuretics. Diuretic means drugs which will enhance the secretion of unwanted fluids or from our body. Mainly it is used to treat edema, which has been formed due to hepatic cirrhosis or heart failure or kidney or any other renal infection. Okay. This is an drug which is against that, antidiuretics. This is a substance which can help to control fluid balance in the body by reducing urination, and it opposes the diuretic action. So particularly, these drugs are mainly used in diabetic insipidus patients. That is the primary indication. And the major endogenous antidiuretics or antidiuretic hormones. So these are all hormones only, and they are used for mainly the ADH is otherwise called as vasopressin. So human ADH is rich in arginine, so also called as arginine vasopressin. So the drugs examples are vasopressin, desmopressin, lipepressin, felipressin, terlipressin, argipressin, pitripressin, sintopressin. Okay, next slide, sir. So this is a schematic way of representing the mechanism of action. So whenever there is hyperosmolarity, it gives a sensor or reflex, it sends a reflex to the hypothalamus. That is, it can decrease atrial receptor firing, also can stimulate the hypothalamus. Then whenever there is an angiotensin 2 release, it also stimulates the hypothalamus. Sympathetic situations or sympathetic stimulation also will stimulate the hypothalamus. Because of that stimulation in the hypothalamus, posterior pituitary gets activated, and you can see the release of vasopressin. So when there is a release of vasopressin, it has two receptors, B1 and B2 receptors. B2 receptors are in the kidneys, and V1 is there in the blood vessels. So here, this V2 receptors, whenever vasopressin is getting secreted, this vasopressin gets absorbed in the two ways. One is V1 and the other one is V2. So whenever this vasopressin acts on V2, the fluid reabsorption takes place in the kidneys. So fluid reabsorption is there from the kidneys. And when it acts on the V1 receptors are predominantly available in the blood vessels. So it produces vasoconstriction, and increased systemic vascular resistance is followed. And because of the last, then there is an increased arterial pressure. And because of increased blood volume, there is an increased arterial pressure. So you must keep in your mind, students, vasopressin acts on two receptors, V1 and V2. V2 is in the kidney and V1 is in the blood. Blood, it produces constriction. In kidneys, when it acts, it produces fluid reabsorption. And because of that, vascular resistance and increased blood volume is there. And due to that, increased pressure is followed. Next slide, sir. So the main uses of this diuretic drugs are, it's used to treat ileus, gastritis, cardiac arrest, diabetic insipidus, nocturnal enuresis, bleeding disorders, and platelet plug formation. Next slide, sir. Antidiuretic hormones, it can also produce abdominal pain, biliary colic, hypotension, and bradycardia. Next slide, sir. So these are the vasopressin receptor antagonists, that is conivaptin and tolvaptan. These are selective. Conivaptan is a drug which can act on V1 and V2 receptors. Tolvaptan is a drug which can act on selective V2 antagonist action. Next slide, sir. So when you give this drug, it blocks the V2 receptor action. It opens the V2 receptor action, but it blocks the V1 action. And because of that, concentrated urine is there, increase in water permeability and decreased free water clearance, lowering of serum and sodium. Next one, sir. And uses, this is used for hypothyroidism and adrenaline insufficiency. Next slide, sir. And when you are using this antidiuretic drugs, it always produces a thirsty, dry mouth, hypokalemia, and orthostasis or hypotension, reduced hypertension. Okay, sir. Next. And this is an elaborate description. It is a substance. Antidiuretics are a substance that help the body retain water, and it prevents the kidney and bladder from removing and eliminating water from the body too quickly. And anti-diuretic medicines are usually used to treat bedwetting and incontinence. Next slide, sir. And the first one is vasopressin, as we know. It structure and synthesis of antidiuretic hormones. It is also, vasopressin is otherwise known as antidiuretic hormone. It is a neurohypophysical hormone which is found in all the mammals. Most of the animals as well as human, it will have vasopressin inside, and in most species, it is available as arginine, and it is also called as arginine vasopressin or argipressin. It is synthesized as pre-pro hormone, and it is processed into nonopeptide, that is 9 amino acid. Next slide, sir. And this ADH is synthesized in the cell bodies of the hypothalamic neurons. That's what, when hypothalamus is activated, this hypothalamic neurons will try to synthesize ADH hormones, and it is stored in the neurohypophysis, that is the posterior pituitary, and functions. Two primary functions are of vasopressin. One is to retain water in the body and to constrict blood vessels. And high concentration of antidiuretic hormone can cause constriction of arterioles, which leads to increased articular pressure. And secretion of antidiuretic hormone is also is also being stimulated whenever there is a decrease in blood pressure and volume. So this antidiuretic hormone will not be done in our body regularly. Whenever the need is there, only this antidiuretic hormone will be secreted. That is, whenever there is a fall in blood pressure and volume, it automatically activates antidiuretic hormone secretion. Next, on the kidneys, vasopressin has 3 main effects. It is increasing the water permeability of the distal convoluted tubule and collecting duct cells in the kidney. And it also allows the water reabsorption and excretion of more concentrated urine, that is antidiuresis. And vasopressin also increases the concentration of calcium in the collecting duct by episodic release of intracellular stores of the calcium. Next slide, sir. And acute increase of sodium absorption across the loop of Henle, and it adds to the counter current multiplication, which aids in proper water reabsorption. And first it will act on the loop of Henle, and then later in the distal tubule, and finally on the collecting duct, where it will allow reabsorption of water into our system. Next one, sir. Use of vasopressin. This vasopressin has been used over the past 50 years to treat neurogenic, that is diabetes insipidus, central diabetic insipidus, and it is also used in reduction in bleeding and blood transfusion during burn wound excision. So whenever there is a burn wound excision, large volume of blood comes out. So whenever there is a burn injury, to reduce the bleeding and blood transfusions, this drug is being used. And it is also used for treatment of upper gastrointestinal hemorrhage, which is secondary to the hemorrhagic gastritis. So it is used for gastrointestinal hemorrhage, okay, to stop it. Next one, sir. And it is also used for the treatment of severe hematuria, reduction of blood loss, and prevention of intraoperative hypertension during liver transplantation. So during liver transplantation, to reduce the blood loss and prevention of hypertension, this drug is being used. And treatment of refractory bleeding after uterine surgery, then cardiac arrest, patients also can be used. Uterus is getting contracted by vasopressin acting on oxytocin receptors. So this vasopressin can be used for uterus contractions also. Why? Because it acts on the oxytocin receptors. Next answer. Then about the drug lipresin. It is a 8-lysine vasopressin and it is less potent than the vasopressin. It acts on both V1 and V2 receptors and it has a longer duration of action and used in place of vasopressin mostly for uh, V1 receptor mediated actions. Next one, sir. Mechanism of action of this liprosin. It can increase the systolic when this drug is given. What happens is it will increase the cyclic AMP, which increases water permeability at the renal tubule. So, resulting in decreased urine volume and increased osmolality. So, there is a decrease in the urine volume collection and increased osmolality is there. Peristaltic movement is also happening directly by stimulating the smooth muscle in the GIT. Next one, sir. Kinetics part, onset of antidiuretic action starts from half an hour to 2 hours. Duration is 3 to 8 hours. Metabolism acts in the liver and kidney. Half-life is for 15 to 20 minutes and elimination is through urinary excretion. Next one, sir. And uses, this one is used to control or prevent signs and complications of neurogenic diabetes insipidus. And the dose is 10 international units intramuscularly or subcutaneously 20 muscular units, which is diluted to 100 to 200 ml of dextrose solution. And adverse reactions when you use this drug, it can produce chest tightness, dizziness, headache, abdominal cramping, increased bowel movements, coughing, and nasal congestion. Next slide, sir. Then about desmopressin. This desmopressin is a man-made vasopressin, which is in the same stage of a normal human hormone, arginine vasopressin. It's a long acting because enzymatic degradation is slow. And the mechanism is this desmopressin works by limiting the amount of water that is eliminated in the urine. The same mechanism only because of this alpresin. And it works at the level of the renal collecting duct by binding to the V2 receptors. It is a specific binder. It only acts on the V2 receptors, which signals the translocation of aquaporine channels, and the presence of this aquaporine channels in the distal nephron will cause increasing water reabsorption from the urine. Okay, it will bind to the V2 receptors first, and it will translocate the aquaporine channels to the distal nephrons. When there is a presence of this aquaporins on the distal nephrons, it will cause the increase in reabsorption from the urine. Next one, sir. Dynamics. Its onset of antidiuretic action starts from 30 minutes to 1 hour and duration is 8 to 12 hours. Metabolism is mainly in the liver and kidneys. Half-life is 1 to 2 hours and elimination is through urinary excretion. Next one, sir. And uses, mainly this drug is being used for bedwetting peoples. That is desmopressin is used to nocturnal ensuresis and nighttime urination. Desmopressin has some benefits in adults who have problem with nighttime urination, known as nocturia, and control or prevent signs and complications of neurogenic diabetes insipidus. And adults, it is 10 to 40 microgram per day, and for children it's 5 to 10 microgram. Okay, adverse reactions, it can produce headache, facial flushing, nausea, hypoatria, and seizures. These drugs mainly another one use, that is whenever a patient is having a low blood pressure, these drugs can be used to increase their blood pressure also. Next one, sir. And then terlipressin. The mechanism action of terlipressin is terlipressin is a long-acting synthetic analog of vasopressin, which can be used in the treatment of acute pericial hemorrhage. It directly constricts the blood vessels through V1 receptor. It is having a selective V1 receptor action, and it controls the bleeding also. And dosage is 4 milligram, which is given through IV infusion every 4 to 6 hours. And this drug is also used to treat the hemorrhage conditions. Why? Because it directly constricts the blood vessels through V1 receptor. That is the mechanism of this drug. And it is also used as a drug which can be used for increasing the blood volume and increasing the blood pressure. Next one, sir. That's all. Thank you for the organizers and the students who are watching this. I wish all the students all the best for the GPAT exams. Thank you.
Thank you so much, sir.
Thank you, sir. I leave the screen, sir.
Yes, sir. Thanks.
Thank you so much, sir. Thank you, doctor.
I think the next speaker is hasn't joined yet. She said she joined in by 11:15. So I'll just give her a ping.
So I have a hello.
Yes, ma'am.
Yeah, I just have a query, sir. I just have a
Yes,
point. This diuretic, part of diuretic, there's a newer generation diuretic called sodium, that is 12-aptan. 12-aptan is also a newer one, where it's a very recent addition to management of the water, sodium excretion in elderly and with heart disease patients. It's a very newer one, very commonly used now, sir.
Okay.
Share the slide, please. Thank you.
So before that, am I audible, sir?
Yes, you're loud and clear, ma'am.
Okay, thank you, sir.
Good morning, everyone. Again, this is the second presentation for today. The next topic is by Dr. C. Vinodhini, who's currently working as an assistant professor, Department of Pharmaceutical Chemistry in SRMC College in Porur, Chennai. So she has done her bachelor's degree from Adipura City College of Pharmacy in Melbourne in 1996 to 2000. Then she has completed a master's degree from Madras Medical College, Chennai, and she has pursued a Ph.D. from SRMC University. She has served as the principal investigator for a few fundings, and she has over 17 years of teaching experience and 2 years of industrial experience. And she's guided B.Pharm and M.Pharm students right through her career. And today she'll be presenting her. She'll present her presentation. Ma'am, over to you, ma'am. Thanks.
Thank you, sir, for the brief introduction. And very good morning to all the student learners. Sir, can I share my screen?
You can share, ma'am.
The screen is visible, sir?
Yes, ma'am.
What about the mode, sir? Is it in slideshow mode?
No, ma'am. Yes, President.
The Renoino Tandalia and the Sun Bio POCT. Is it required to take test?
Can I continue?
Yes, ma'am. You're not on full slide, ma'am. Full slideshow, ma'am. I think it's taking a bit of a time.
Not at in slide mode.
No, ma'am. Can you close and open again, please?
I've reshared it, sir. What about
Okay.
now?
Can you go for the slideshow, or is it in slideshow mode?
I'll join back, sir.
Okay, ma'am.
Give some 1 minute, sir.
No
Just-
problem. Yes, ma'am. Go ahead, ma'am.
Is it okay now?
I can see all the slides actually, like each slides in one show, one screen.
Is it okay now?
Yes, go ahead, ma'am.
Yeah. Okay, the topic of discussion is terminologies and workout problems in UV visible spectroscopy. So dear learners, you all can agree to me that any course, irrespective of engineering or pharmacy or any subject, irrespective of pharmaceutical analysis or pharmacology, generally we have to depend upon 3 domains of learning. What is that 3 domains of learning? Number 1 is knowledge. Knowledge is nothing but the student should explore towards the basic concepts and fundamentals of any analytical techniques or any basic concepts and fundamentals related to the subject that is concerned. And number 2 is skill. So I could say that around 40% of knowledge component is compared or concluded in the syllabus, along with the 60% of skill component, where you're going to explore your knowledge towards the action of the techniques, that is whether it is non-instrumental or instrumental method of analysis. So that is called a skill component. And moving on to the third component, which is attitude, is nothing but the applications oriented. So applications oriented is nothing but, you could see in your syllabus that the application is towards qualitative or quantitative aspects. So how the learners are going to implement the applications in your job atmosphere or in your future studies. So you have to cover the applications towards both industrial as well as towards the clinical perspectives. So once the student or any learner is thorough with all these components, which are considered as domains of learning, so definitely there is a good outcome you can see from any of the competitive exams that you're going to appear for. So I have a plan to have this session in 2 parts. The first part will be about your principles or the fundamental concepts and various terminologies that are concerned with the UV visible spectroscopy. And the second part might be onto the calculations concerned with the spectroscopy, because most of the GPAT earlier question papers, I could able to revise it and see there are some calculations asked towards the UV visible spectroscopy. The first part, which is on fundamentals, you can see that there is a first definition in which you all can even recall the definition. What's an analyte? Analyte is nothing but any substance or sample that can be analyzed. And the procedure is called as analysis or analytical method. And based on the sample size, we can even classify the analysis as macro, semi-micro, micro, submicro, and ultra-micro, trace analysis, and out of which semi-micro analysis are most widely employed because they falls in the range of milligrams. And also you can agree to me at the end of your first year program, that is pharmaceutical analysis, you all can familiar with these terminologies like molar, normal, percentage, assay, percentage purity, actual molarity, molecular weight, parts per million, which is nothing but you can even express in terms of weight by volume, weight by weight, volume by volume, and so on. So these are all the familiar ones till you pursue your final year. But after the pursuing your final year of the program, you may be familiar with these terminologies, which comes under spectroscopy part of it, and the rest of the things even covers the chromatography as well as your other techniques like polarimetry. So as far as spectroscopy is concerned, a few I've listed here like absorbance, percentage transmittance, absorptivity, molar absorbance, and few more we have to discuss in detail in this session. And apart from that, you have retardation factor, retention time, optical rotation, specific rotation, theoretical plate, staining factors, which actually falls onto the chromatographic topic as well as in the polarimetry. And even you have many more terminologies with other, the topics.
Ma'am, just to interrupt, sorry. The slides are not moving, ma'am. It's stuck, I believe. Okay, it's currently in part 1, fundamentals of spectroscopy. Is that what you're?
Yes, sir. Yes, sir.
Okay, go ahead, ma'am.
I really do not know what is the problem.
No problem.
The same way I did it today. Maybe.
It's okay, ma'am. You can just move one slide after that. Not a problem.
Is it okay now, sir? I'm in the right slide. I'm in the correct part.
It's in part 1, fundamentals of spectroscopy, part 2, calculations in spectroscopy. But it's not on slideshow mode, it's on single screen mode.
I'm sorry for this. Really,
No problem.
I don't know, even after trials, I don't know what is happening. Really
Yeah, now
sorry.
it's in full slide, ma'am. Yeah, it's
Now
moving now.
Sir.
Yes, ma'am. Go ahead. Sorry.
Dear learners, I'm really sorry for that. I don't know exactly what is the problem. So should I continue with this slide?
Yeah, you can continue where you left off, ma'am. No problem.
Okay. So the various terminologies, what you already know, and few things, of course, this session may be helpful for you. And also we generally start any session with the learning objectives so that the student may be getting an idea of what I'm going to talk about for this whole session. So at the end of the session, the learners, you'll be able to define spectroscopy, enlist the types of electromagnetic radiation, describe the properties of electromagnetic radiation, and also you can define the units related to electromagnetic radiation. You can express the relationship between energy and electromagnetic units and define monochromatic light. You can relate Beer's law. Definitely, I'm not going to derive it today. And express symbols like I0, IT, IA, B, T, C, K, etc. And you'll be able to draw a visible or UV spectrum. You can able to predict the lambda max in the given spectrum. You can relate lambda max with concentration. And also you can define these terminologies like absorbance, transmittance, specific absorbance, and so on. And define chromophores with examples, classify oxochromes with examples, and finally you know to plot the calibration curve, whether it is under spectroscopy or chromatography, and what parameters does it relate to each other. So once if you are explore onto these and you are able to recall during your exam, I think it's fine to go with the this topic during the exam. So so just it's a task to learners. Can you identify this terminology? Because creative thinking is very, very important when you appear for a competitive exam. So can you, anybody, sir, can you please help me from the chat? Somebody has responded to this.
So far, no one has responded, ma'am.
So just you have to connect the pictures and get me terminology. Okay, not taking much time. It's nothing but UV visible spectroscopy to just check your creative thinking. Anyhow, you can relate later on much better than now.
Yes.
So what is spectroscopy?
We have a few answers, UV visible spectroscopy and UV spectroscopy.
Oh, that's fine. That's congrats to the students. So it's a branch of science that deals with the study of interaction of matter with light. This is how we define the spectroscopy. But later on, when you look into the definition, the light is replaced with a term called as electromagnetic radiation, which we abbreviate it as electromagnetic radiation as EMR. So there are different types of EMR. So based on difference in the EMR that is employed, different spectroscopies has evolved. And not taking much time, briefly, I'll discuss about this electromagnetic radiation. It's nothing but a ray of light that passes through a sample. So it has its own magnetic as well as electrical field, which are perpendicular to each other, and that facilitates the propagation of direction of the rays or light towards a particular wavelength. When you look into the electromagnetic spectrum, here very important thing that you have to relate is energy and wavelength. Wavelength is expressed as lambda and energy will be stated as E. So you have to remember that energy is inversely proportional to wavelength. You can see from the diagram there is different types of electromagnetic radiation. So in the middle you have visible light, and to the left it is ultraviolet, X-ray and gamma rays, and towards left it is infrared, and you have microwave in between, and followed by that radio waves. So why? Because this is very important. You will be getting a question stating that which has more energy or which absorbs at higher wavelength or lower wavelength or less energy. So that kind of questions are possible with the exam. So you should know that energy is inversely proportional to wavelength. So from the visible light towards left, there is increase in the energy. The arrow is towards the left, and towards the right there is increasing the wavelengths, but both are inversely proportional, which means when energy is more, it absorbs at the shorter wavelength and vice versa. So this spectrum you should able to recall properly so that you can answer correctly. So to quickly to know about the wavelength, which is symbolized as lambda, and it is nothing but distance between two successive troughs, that is nothing but the minima, and the crest is nothing but the maxima. So it's expressed in terms of nanometers practically, but it also has other units like angstrom and millimicrons, even microns, meters, etc. So here I'm insisting that a student or learner should know how to convert a nanometer to a meters or a angstroms. So 1 nanometer is equal to 10 angstrom, which is otherwise 1 nanometer is equal to 10 to the power of minus 9 meters. So generally this particular unit, that is EMR unit, which is nothing but the wavelength, is employed in UV visible spectroscopy, atomic absorption, flame photometry, and fluorimetry. And the next terminology is about the wave number, which is symbolized as nu bar. So this nu bar is nothing but the number of waves that is passed through 1 centimeter. So in the picture, you can see that there are 4 number of cycles that is passed. So 4 in 2 centimeters. So you can write that 4 cycles per centimeter. That's how you calculate the wave numbers. So again, you can use a formula, which is nothing but mu bar is equal to 1 by lambda. Lambda is the wavelength. So that's how these wave numbers are employed, and specifically it is helpful when you explore your preparation towards IR spectroscopy. And the third electromagnetic radiation unit is nothing but frequency, which is symbolized as nu. This is nothing but number of waves that passes through a particular point in a second. So the unit is second inverse, and also it can be expressed in terms of hertz. And this particular unit is employed in nuclear magnetic resonance as well as electron spin resonance spectroscopy. Yeah. The next task, can you now identify? I can just go with one clue for you. It's a fundamental laws for absorption of light. What is the terminology? Any student can recall it, sir?
I'm waiting for a response, ma'am.
As of now, no response. So just identify the
Beer-Lambert law is the term.
Yes, Beer-Lambert's law. That's a good.
Got it right. Yeah.
That's a good identification by the student. I think when I on my video, there is a problem.
Okay, you can switch off your video and go on with this session. Not a problem.
Slides are moving, sir.
It's in fundamental laws for absorption of light.
Yes.
Yes.
So it's a Beer-Lambert's law. So let me quickly describe the law. Before that, I wanted to emphasize the various components that is employed in spectrophotometer. And you all can agree to me, it will require nearly 5 to 6 hours to describe the components in detail individually, but I'm going to brief it here. So first component is about the light source, which is able to produce light of many wavelengths, which we call it as polychromatic light. So the light from the source is not a light of single wavelength, it is a light of multi-wavelength or many wavelengths, which we call it as a polychromatic light. So you cannot send this polychromatic light to the sample. So in between sample and the light, we have to place a second component, which we call it as wavelength selector. So wavelength selector is nothing but it selects a particular wavelength from many wavelengths. That is, it converts the polychromatic light into a monochromatic light. So monochromatic light is nothing but a light of single wavelength. So that's how you can arrive at this. You can either use a filters, or you can use gratings, or you can use prisms. So any of these can be employed in between a source and the sample holder in order to convert the polychromatic light into a monochromatic light. So once this monochromatic light passes to the sample holders generally we name it as cuvettes. So these cuvettes holds the sample of our interest. And after absorption, so how does the absorption takes place? Because of the electronic transition. So electronic energy is a transition from ground state to excited state. And thus the absorption happens with respect to the concentration of the sample that is uploaded. And once after the absorption is over, whatever the light that is coming out is called as transmitted light. So I0 is nothing but intensity of incident light. IA is intensity of absorbed light, and IT is intensity of transmitted light, which is coming out, which is the detector. So the third component is sample holder, and the fourth component is the detector. So what is the role of detector? Detector will convert this light energy. You all agree that transmitted light is in the form of light energy. So light energy is converted into a electrical energy, and we have various choices of detectors. So that itself is a 1 or 2 hours lecture. So you can just go back and recall the different types of detectors, and this detector will convert the light energy into a electrical energy. And of course, you need a fifth component, which is called as readout device or amplifier or something like a data processor, which convert this electrical energy in terms of absorbance. Because whenever you do practicals using a spectrophotometer, the parameter which you are going to measure is absorbance, and also at its particular wavelength, we call it as lambda max. So this is the overall view about the spectrophotometer. How does it work? Quickly, I described it. And the next component is about the law. So when you look at Beers-Lambert's law, you can see that this is the law which you arrive after a series of sequence of derivations. And this is a Beers law. And the one fine thing that you come at the end is nothing but absorbance is directly proportional to concentration as per Beers law, and absorbance is directly proportional to thickness. You can represent it as B, or sometimes in some books it is T. So which is nothing but the Lambert's law. So the combined law is nothing but A is equal to KBC or KTC. So this relationship is very, very important, and you should know to express the alphabets, whatever is concerned. Now moving on to the Beers-Lambert's law. So let us take two scenarios here. The first scenario, assume that your concentration and thickness is 0, which means no sample, and also the thickness is not incorporated here. In that case, you cannot see any kind of absorption taking place. So whatever the incident light comes out as an incident light. But in the second scenario, when you look into that, the incident light, now it is converted to the transmitted light, because we are incorporating the two parameters here. One is concentration, which is 0.01 milligram per ml, just 10 micrograms per ml, which is concentration, and thickness is 1 centimeter path length. So that's how you can see the variation in the incident light, because it is getting absorbed by the samples in the proper thickness that is employed with the cuvettes. So now we have to understand better in 3 aspects. The first aspect is Lambert's law, which is related to the path length. The second will be on concentration Beers law, and the third will be wavelength also. So let me first talk about this Beers law, how it is dependent to the absorbance. So you can see there is a source. Of course, we have to place a sample holder in between. There's a detector, and you can see the readout device over there. And first, when I keep a thickness of 1 centimeter, you can see there is a change in the absorbance. Previously it is 0, now it is 0.22, which means the thickness has a relationship towards the absorbance. Suppose if I increase the thickness in the next case, thickness increasing means it's not keeping 2 cuvettes. Of course, we have a provision to keep only 1 cuvette on the path, but it is doubling the path length. So you have to increase the thickness twice. Say for example, previously it is 1 centimeter, now you have to take 2 centimeters. So the thickness is increased again. You can see there is an increase in the absorbance. So previously it is 0.22 with 1 centimeter, and now it is 0.44 with 2 centimeter. And obviously it goes with the 3 centimeter as 0.66, because you're tripling the thickness. So thickness is directly proportional to absorbance. That's what the Lambert's law tries to relate. And the next scenario is about the concentration dependence. So where you are going to place a light blue color solution, which has absorbance as 0.42. So it's nothing but a sample, which is light blue color of particular concentration. And when you increase the color of this sample to the next level, so increase in concentration, maybe the previous one is 10 microgram, and the next one you increase to 20 microgram. In that case, you can see the color intensity is higher. So as the intensity is more color intensity, that shows your concentration is increased. And once your concentration is increased, your absorbance also parallelly increased from the previous case, that is 0.4 to 0.63. So that's how you can study the Beer's law, which relates the concentration and the absorbance. And the blue solution do absorb the red radiation. So you can see there is a blue solution and it absorbs the red radiation, and you are able to see the absorbance. So, and the statement also says that red solution will not absorb the red radiation. So the same color of the light which is incident cannot absorb the color of the solution. So you have to understand now this particular phenomena, which we call it as a color wheel, to understand the principle of absorption in the visible spectroscopy, which is completely dependent on the wavelength. So this helps us to select the filters when you incorporate visible spectrophotometric estimation. So you have to choose the color which is complementary or opposite to the diagonal to that of the color wheel. So generally we divide the color wheel into six component, and the one component in the 6 will be again divided into 2, because there is no much difference in the violet and the indigo. You all can recall the VIBGAIA here. So VI stands here: blue, green, yellow, orange, and red. So each color has its own unique wavelength range. You can infer from the color wheel. And suppose your color of the solution is red, you have to choose the green filter, that is opposite or diagonal to the color. Suppose your color is blue, then you have to choose the wavelength which is diagonal towards orange. Suppose your color is violet, you have to choose yellow. Here you can recall the colorimetry paracetamol. You all might have done your practicals where we estimate colorimetry paracetamol at 450 nanometer, which is nothing but the color of the paracetamol after diastrization, and you will be analyzing at 450. Because why 450? Yellow color opposite is violet color, and violet color falls between 400 to 430 or 460. So that's how you choose the filters based on the complementary to each other. And next is about this thing, absorption maximum, the next terminology, which is expressed as lambda max. So always students confuse that when we ask to define them lambda max, they say it's a maximum wavelength. Definitely not. It is not the maximum wavelength. It is the wavelength at which maximum absorbance is achieved. So first you should know to identify the spectrum, whether the spectrum is UV or visible, or it is UV visible. So how do you identify it? If it is UV, it falls with the range of 200 to 400, and it is visible, it falls in the range of 400 to 800, and it is UV visible means it is like the third picture. You can see this is UV visible spectrum, where your range is from 200 to 700. So first thing that a student should have a skill in identifying or differentiating the different spectrum. And also how do you differentiate with respect to the wave numbers range, that is wavelength range that is given. And after you identify the spectrum, you should look at the spectrum. In this spectrum you have two parabolic peaks, and here you have 3, and the next you can see there is a comparison of sample, standard, and extract. So 3 different, that's nothing but the overlay. So in this overlay you can see that the lambda max. So out of 2, what is lambda max? The lambda max is nothing but the wavelength at which maximum absorbance is achieved. That's nothing but the lambda max. So it is not the maximum wavelength. Of course, it is same here. Wavelength also maximum, absorbance also maximum. But here, when you look into the second spectrum, you have 3 different peaks: 443, 471, 502. But the lambda max is what? Lambda max is 471, because this is the one which is giving a maximum absorbance, whereas even though 502 is the maximum wavelength, that is not the lambda max. So please assure that lambda max is nothing but it's a wavelength at which maximum absorbance is achieved. Okay. And what do you mean by overlay of UV spectrum? So you can compare the presence of standard with that of the sample. It's absolutely a qualitative applications where you can compare the standard spectrum with that of the sample. So you can see a standard, so you can see here the standard, which is shatawarin, and it is compared with that of two extracts, aqueous extract as well as alcoholic extract, so that they overlay each other, and we can identify that the aqueous extract as well as the alcoholic extract contains shatawarin as a sample. So that's about the lambda max. And the next we are going to discuss about how the lambda is related to the concentration. Definitely it is not dependent, it is independent to concentration. So when you increase the concentration, of course, you can see there is an increase in the absorbance, right? Your peak height is increasing from 5 to 25. There is a serial increase in the concentration, because we know that concentration is directly proportional to absorbance according to BS law. But the concentration is not directly proportional to lambda. Whatever the concentration, your lambda remains the same, right? Here the lambda is, I can say it's around 580 nanometer. So your concentration varies, but your lambda does not varies here. So lambda is independent to that of concentration. That is one more terminology you should know. And this is another important principle that you understand, which talks about the absorption happens when UV light or UV radiation or UV electromagnetic radiation is passed on to the sample. So electron transition happens. So we have three different types of electrons: sigma, pi, and in electrons. So sigma and pi are bonding and n is non-bonding. They do have their respective anti-bonding orbitals in the higher energy state. So this we call it as a ground state, and the higher one is excited state. So when there is a transition from ground to excited state, the absorption takes place. So this is actually studied. So based on the different types of electrons, the energy consumed also varies, as well as once the energy varies, your wavelength also going to vary. And you have to recall that energy is inversely proportional to wavelengths. So let us summarize, because I could not have time to discuss individual transitions in detail, but kind of hints that I can give you that. So when you, sorry, this is not 2135, this is 135, it's a error. So alkanes, so generally the alkanes will have sigma to sigma star transitions, which is a saturated compound. And similarly, you can look the second one as N to sigma star, where it is still alkanes, but it is with the heteroatom. So for example, the first case, it is methane, which is alkanes. The second case, it is alkanes with saturated compound, I mean heteroatoms like bromide, alcohol, CH3OH. So saturated alkanes comes under sigma to sigma star, but it is saturated along with the heteroatoms, whether it is oxygen, nitrogen, or sulfur, or halogens like bromide, then it falls under the second transition, which is N to sigma star. So sigma to sigma star requires higher energy, and N to N star less than that. So since it is higher energy, it absorbs at lower wavelength. The next one is, you can see this is less energy compared to that of sigma to sigma star. So it absorbs at little higher wavelength. So energy is less means your wavelength is, one second. If your energy is high here, so wavelength is less. So energy is little less here, so wavelength is high. So that's how you have to relate the energy and wavelength. And the third one is pi to pi star, which is very important transition that happens in a pharmaceutical compound, because most of our pharmaceutical compounds are organic with unsaturation. They may contain double bond or triple bond. So when this is these conjugations are there, so they are considered as a UV active species, and they have absorption, good absorption in the UV radiation. So that's how you can differentiate and study each transitions and the respective compounds as an example, so that you can easily able to answer. And the last one is N2 pi star, which again falls on unsaturation with heteroatom. So you have only four categories: saturated, saturated with heteroatoms, number 3 unsaturated, and number 4 is unsaturated with heteroatoms. So that's how you can classify the transitions, and quickly you can remember the or recall the wavelength range, and you can express the answers. And the next phenomena is absorbance. You have 3 different formulas to calculate. A is equal to minus log T or log 1 by T or 2 minus log percentage T. It is otherwise called as optical density. In biochemistry estimation, we used to represent absorbance as optical density. And if absorbance is 0, it shows that it's 100% transmittance. That shows that absorbance is inverse of transmittance. So transmittance can be expressed as T is equal to intensity of transmitted light by incident light, or simply you can state that absorbance is inversely proportional to the transmittance. And And the next phenomenon is very important phenomenon, which is a constant value, which you can even find these values in methods that are available in pharmacopoeias, where we use standard absorptivity, which is otherwise called a specific absorbance value, which is represented as A 1% 1 centimeter or small a. So any of the way you can express this. And the formula to calculate this small a is, you know this equation from Beer's-Lambert's law, A is equal to ABC. So you can calculate small a with respect to A by BC. And the unit which is comprised or comes under specific absorbance is deciliters per gram per centimeter. So why it is gram per? So deciliters is nothing but 100 ml. So when you look into the definition, you can see that it's an absorption measured for 1%. What do you mean by 1%? 1 gram in 100 ml solution. So that is nothing but 1% solution. So what is the absorbance that you arrive when you measure 1 gram in 1 ml of solution in 1 centimeter path length using a spectrophotometer? So that value is called as absorptivity. So you can recall that many times you would have used this value 715 for paracetamol estimation at 257 nanometers. So you all know that when you change the solvent or pH, even the absorbance as well as wavelength has series effect on that. And the next one is molar absorptivity. Here the difference is you're going to measure the absorbance for 1 molar solution. In the previous case, it is 1 gram or 1%, right? And here it is 1 molar solution for which unit concentration in 1 centimeter. So the unit is moles per liters per centimeter. And this is a formula which you can calculate molar absorptivity. So small a is nothing but specific absorbance, what we have discussed in the previous slide. And you need a molecular weight of the compound to calculate the epsilon max divided by 10. Now, as a student, you should understand how this 10 has arrived into the formula. How does it exist? So with a simple example, I wanted to differentiate what is 1% sodium hydroxide and 1 molar sodium hydroxide. So in case of 1% sodium hydroxide, it's nothing but 1 gram and you dissolve in 100 ml solvent. But 1 molar is nothing but 1 molecular weight, which is nothing but 40 grams, right? Sodium hydroxide 23 plus 16 plus 1, that comes around 40. So 40 grams when dissolves in 1000 ml, that becomes 1 molar. So you're going to relate in the formula the A as well as the epsilon. So both should be related. So when you relate E max with A 1% 1 centimeter, that is molecular weight in 1000 ml is related to 1 gram in 100 ml. And when you do the calculation, finally you can see that you can arrive at 10 divided by 10. That's how the 10 value is existing in the formula. So formula to calculate molar absorptivity is nothing but A into molecular weight divided by 10. Okay, the terminology is almost, I'm about to complete this first session. What is this terminology? Anybody can recall if you're able to identify a bird? What's the terminology? Any students have lectured?
Not yet, ma'am. Let's give them a
Okay,
minute.
what is a bird? What is a bird? It's a crow. Just try to recall. Okay.
Chromatography, is that right?
It's not a chromatography. We are not talking about chromatography in the session, students. Please recall some terminology from spectroscopy.
Chromophore is another term they sent.
Chromophore, yeah, that's a correct answer. A good identification. Chromophore. So chromophore, as you all know, that it's very important component of the groups that is responsible for having absorption in the light, I mean UV or visible light. So generally they say they're unsaturated covalent bonds, very important. So this fact will able to differentiate chromophores from oxochromes. So please be clear that they're unsaturated covalently bonded functional groups. You can say they all are unsaturated. Unsaturated means they should have double bonds or triple bonds with multiple bonds also. So they are responsible for imparting color to the groups. So that's nothing but chromophore, which is very much important for having absorption in the UV spectrophotometer. And also extended conjugation. Extended conjugation means, suppose you have a double bond connected to a carbon, which double bond, then single bond, again carbon with double bond. So alternate double bonds are called as conjugated dienes, or even it can extend to trienes like this. So this kind of structural features are present in the compound. They may have very good absorption in the UV spectrum. So this is the best example I can show here. So this compound absorbs at lower wave number, whereas this at higher wave number. So what's the reason? So here the conjugation is missed out in the first case. Conjugation is missed out because double bonds are separated by 2 single bonds, right? 2 single bonds. But here the double bonds are separated by 1 single bond. So it's a conjugated structure. So it has absorption at the higher wavelength. So if the conjugation is more, your absorption towards the higher wavelength happens. And that's about oxochrome. So oxochrome, you can now differentiate. I said chromophores are only unsaturated, but oxochromes can be saturated or unsaturated, because you may get questions with listing some 4 choices of different groups, saturated and unsaturated, and you have to identify whether it is chromophore or oxochrome. So in that part, this knowledge will help you. So oxochromes are groups which may be electron donating or electron withdrawing groups, which have which will not responsible for the absorption, but they can alter the absorbing capacity or the wavelength. For example, your absorption is more, they can decrease the absorption. If it is high wavelength, they can decrease the wavelength, or they shift the wavelengths towards various factors. Sorry. Sir, hello, I think.
Yes, ma'am.
I think there is some problem, sir. Hello.
Yes, ma'am. I can hear you. I think you've used the stylus pretty fast, it seems.
I'll share once again, sir. Sorry
Okay.
for that. How about now?
Yeah, it's clear, ma'am.
So here you can understand, I think something problem when I use the
No,
pen.
no, yes, I think the pen is moving a bit fast.
Okay. So here you can see there is a compound which is benzene that has absorption at 255 nanometer.
Yes.
So you can see here benzene absorbs at 255 nanometer and phenol is at 270 nanometer. Why phenol is absorbing at higher wavelength compared to benzene? So now you have to interpolate it. There is a presence of OH group. So OH group is an electron donating group. When it is incorporated to benzene, there is a shift in the wavelength. So the shift is towards the higher side. And similarly, you can see when you introduce another group, which is amino group, into the system, then you can see there is a presence of, so there is a presence of increase in the wavelength, 280 nanometer. So why there is an increase in the 280 nanometer from 270? Because of the introduction of this electron donating group, amino group. So now the question arises here, why amino absorbs at higher wavelength compared to that of the hydroxyl group, 270 to 280. So both are electron donating group, but what is the difference? You all can agree that electronegativity is higher in OH, whereas it is less in amino groups. So oxygen is highly electronegativity. So greater the electronegativity will shift the lambda max towards the shorter side. So this is the concept you should be able to recall when you're answering towards the oxochromes kind of questions. So when electronegativity is more, then it shifts the wavelengths towards the shorter side. That's why phenol is absorbing at shorter wavelength compared to that of the aniline, which is having absorption at 280 nanometers. So this kind of interpretations you should do before you go with the other activities. Okay. Now, next is about the various shift effects. So you have 4 types of shifts in the oxochromes. One is red shift, which is otherwise called as bathochromic shift. The other one is blue shift, which is called as hypsochromic shift. And the other one is hypochromic effect. And the last one is hypochromic effect. What is red shift? Red shift is nothing but shift towards the longer wavelength, towards the higher side. So you all can see here, if I put 200 to 400 or 800 nanometer, the whole UV range, and you can see here there is a shift towards the right side, which is called as red shift. That means shift towards the longer wavelength, and towards the left is called as blue shift, which is nothing but the shorter wavelength. And what is hyperchromic? Hyper means increase in the effect, right? Increase in the Emax value. When your molar absorptivity value is higher, then we call it as hyperchromic effect. And the other one is hypochromic effect, which is shift towards the lesser molar absorptivity value. So these things also you should be thorough when you go for answering the related questions. And this, so the slides are moving. Next slide is visible, sir.
I can see the shifts and effects slide, ma'am.
I think the forum is not supporting my system. I'm really sorry for that. Is it shifting, sir, now? No.
It's on shifts and effects, ma'am.
What about now, sir?
Yeah, it's on linearity.
Yeah, linearity. So next terminology is linearity. Is it shifted now? The next graph?
It's a linearity now, ma'am. Yeah, linearity curves.
It's taking some time, sir. I'm sorry. Yeah.
No problem.
Okay. So you can see here different linearity curves, which I just wanted to compare. Being it's a session for spectroscopy, I thought I can just cover the other aspects of analytical methods also. So first linearity curve is HPLC, then flame photometry, fluorimetry, UV visible, and atomic absorption spectroscopy. In all the 5 plots, you can see one parameter which is a very similar or very common, that is concentration. But concentration varies with the unit. In one case, it is picogram per ml. In case of fluorimetry, in UV it is microgram, and in HPLC also it is microgram, and in flame photometry it is in terms of millimoles. So concentration can be expressed in any units, but your x-axis is going to be same when you plot a linearity curve in all the techniques. So x-axis is concentration, that is series of different concentrations of solutions are prepared, and you're going to measure the responses. So what is the response in HPLC? HPLC is going to be peak area, and in flame photometry it is flame intensity, in fluorimetry it is fluorescence, in atomic absorption again it is absorption like UV visible. So the parameters of y is always an unknown parameter, you all agree to me. We need 2 parameters to plot a graph, x-axis and y-axis. X-axis is a known parameter and y-axis is an unknown parameter. So unknown parameters only varies with the different techniques, but the x-axis, which is a known parameter, is going to be concentration. So as a student, you should know how to plot a linearity curve. So x-axis is concentration and y-axis is the. So linearity is very important analytical method, validation parameter, which even you have it in your GPAT syllabus, like precision, accuracy, specificity, sensitivity, LOD, LOP, like that linearity plays an important role. So what is use of this linearity? Linearity helps us to predict the unknown concentration. So once if you plot the curve, you can see there is a prediction of unknown concentration by interpolating in the, you can see that interpolation even in flame photometry as well as in atomic absorption spectroscopy. So I'm getting problem when I use my pen, sir. So I'm not using it right now. I try to explain, make it understand. Okay, sir?
Okay, go ahead.
Because the Zoom is not supporting. Google Meet we used to take. So I'm sorry for that.
Okay.
And now the questions, students, you are able to give the answers. I'll be happy in your chat. So can you just tell me whether which absorbs at longest wavelength? This you have to recall the effect of conjugation, which is a qualitative application.
Ma'am, the question is not visible on the screen.
That's what's taking some time, sir.
Okay. Do you want me to share your slide?
I will close and reopen, sir.
Okay.
Is it moving, sir?
Yeah, it's moving, ma'am.
Just quickly skip, sir.
Yes, please.
Yeah. Is it visible now?
Yes, ma'am, it's visible.
So the question is about which molecule absorbs at the longest wavelength, 1,3 hexadiene or 1,4 hexadiene. So as I said, you have to use effect of conjugation. So that probably that concept you should recall here, effect of concentration, conjugation. So I explained what is conjugation, right? Double bond is separated. Does any student have answered this, sir?
Yes, ma'am. I have a couple of answers.
Answer is 1 or 2.
1, ma'am.
1 is correct. So extent of conjugation. So here the conjugation, double bond, single bond, double bond, whereas here the conjugation is missed. So answer is 1,3 hexadiene. So next question. What about these molecules? Same concept you please apply. So here you have double bond, single bond, separated by one more single bond, double bond. So it is non-conjugated. Whereas here it is double bond, single bond, and double bond, and then single bond. So conjugation is intact here. So B will have absorption or
Chare got it correct.
Pardon, sir?
A couple of students got this answer correct as well.
Okay, very good. So what about this A or B? The same concept, just I've given a few more questions on that. A or B, longer wavelength. You see the number of double bonds and also the conjugation. So here 2 double bonds. Here 1, 2, 3. See why conjugation representation very important, because I have not given the task for Woodward-Fisher rule, and students please don't forget to work out on those problems. If suppose given an opportunity later, I may happy to share this one more session also on Woodward-Fisher, but please don't forget to work out problems on Woodward-Fisher. This effect of conjugation or extended conjugation is very, very important. Definitely you have to work out on that for your competitive exams. So 3 pi bonds, 2 pi bonds, and this is related to organic chemistry. So just I quickly describe this, not giving a choice to you. So this is a reduction reaction. So this conjugation will go off. So double bond, instead of double bond, it will be CH2, single bond CH2 here. So conjugation is lost. So no conjugation. So definitely it will absorb at shorter or lesser wavelength. And here you can see it is a dehydrobromination. So when bromine is removed, there is a formation of double bond here. So double bond is formed. So it is longer wavelength. And this is pyridinium carbonyl carbonate, which is an oxidizing agent. So OH will be converted to double bond O, ketone. So double bond, single bond, here it becomes ketone. So double bond. So conjugation is there. So likewise, you should know how the product forms and what is the change in the product, whether the product is conjugated or non-conjugated. Based on that, you can say that whether they have shorter wavelength or longer wavelength or longer wavelength. So like that, you can interpret and study your questions. So now this is another question. The first question is, what is x-axis and y-axis? What is x-axis? These values are nothing but wavelength. And what is this? Absorbance. So wavelength, when you express, you have to express as nanometer. And absorbance does not have a unit. It's an arbitrary unit. And predict lambda max. So you have 1, 2, 3, even 4, very small peak. So lambda max is what? It is the wavelength at which maximum absorbance is achieved. So here the lambda max is 410 nanometer. So one question was there in the question book, GPAT book, predict the lambda max from the choices given. Okay, the next question. So this is with respect to the principle of colorimetry. I was talking about the color wheel. So suppose copper sulfate. So what is the color of copper sulfate? The student should know the color, then only they can relate the concept here. What is the color of copper sulfate? You might have used in your Biuret test, right? And diazotide solution, even final years have a chance of doing it in your practical classes, converting a colorless paracetamol to a diazotized compound. So any color has been chatted, sir, in the chat. But copper sulfate?
Blue, ma'am.
Okay. Sulfate is blue. So
Yes.
copper sulfate is blue. Its complementary color falls on the range of orange. So it will have absorption in 600 to 640. And diazotide solution is what color? Yellow color. So yellow color complementary is violet. So the yellow color solution will have absorption at 400 to 450 nanometers. So that's how you can relate, use the color wheel to relate the transmitted color as well as the absorbed color. So I've given the description. At your convenient time, you can look back the slides. So the one more terminology is nothing but the isobestic point. So isobestic point is the one which is even asked one time in the GPAT. So what is isobestic point? So it's a wavelength. So suppose two different compounds, you have X and Y compound, two different compounds are there and you have scanned them in a UV range or UV visible range. So the wavelength at which both intersect at the point, right? This point. So what is there? At this point, both the compounds have same absorbance, is it not? So the wavelength which is particular, so you have two peaks like this, and this is the point at which you have the same absorbance. So the wavelength at which you have same molar absorptivity for two different species, then that point is called as isobestic point. And this point really helps when you wanted to estimate the amount of impurities in the sample. And this is the shifter. So what is the red color arrow? It's a number 2 is what? Number 4 is what? 3 and 1. So 2 is towards the longer wavelength. So it is bathochromic shift. Sorry, it is a red shift or bathochromic shift. And 1 is blue shift, which is hypsochromic shift. And 3 is hyperchromic effect and 4 is hyperchromic effect. And of course, you should also know to label the compound, the parts where it exactly lies. You should know that first accessory is source followed by 2 slits, right? Entrance as well as exit slit. And in between the entrance and exit slit, you have a wavelength selector. Here it is represented as prism. So this is light source, this is entrance slit, and this is prism, this is exit slit, and this is sample holder, and this is detector. And even you have one more ROD, which I have not shown here. So these are the components of spectrophotometer, and how the detectors, each detectors works, what is the principle, will definitely has high scope for your questions. So the next part for another 10-15 minutes, the last part about the calculations. So the detailed description I've given in the slides, but I will brief it as far as, sir, I have how much time, sir?
Ma'am, you can take your time, ma'am. We don't have any restrictions.
Really? Oh, that's fine, sir. Then I'll go.
As long as students are interested, you can go ahead.
Okay, sure, sir. I don't have any time limits. Okay. I'm happy if you give me
sure,
more time, because, yeah. So the objectives for this session, probably you may be able to calculate the wavelength, absorbance, transmittance, concentration, absorptivity, molar absorptivity. So these are the various terminologies I discussed just before, and also with the formulas, right? So now we are going to incorporate these formulas into the problem solution statements, and we are going to arrive at the results. And so many of them might have started your preparations, and I hope that you could have seen some calculations in the questions. So I think this session may be a little helpful to you. So find wavelength. So the first question is how to convert 5 nanometer to meter. So for this question, the student should know what is 1 nanometer in terms of meters. You all can recall my lecture before, where I stated that 1 nanometer is equal to 10 to the power of minus 9 meter. So no, correct? So 1 nanometer is equal to 10 to the power of minus 9 meters. So 500 into 10 to the power of minus 9 meters. So just changing the decimals, it becomes 5 into 10 to the power of minus 7 meter. So this is one question. So you know to convert nanometers to meters, provided you should know that 1 nanometer is equal to 10 to the power of minus 9 meters. Okay. And the next question, you have to calculate the wavelength, but the parameter given to you is frequency. So to address this question, you should know the relationship between wavelength and the frequency. So you all know that frequency is equal to C by lambda, or lambda is equal to nu by, sorry, one second. Lambda is equal to C by nu, right? So you have to know this formula, and what is asked wavelength. So you have to interpolate the formula such that you get a formula for a wavelength. So C by nu, what is C? Speed of light or velocity of the light. So students should know or aware of this, the value. So it's a constant value, speed of light. We were studying from our school days in physics class, right? So 3 into 10 to the power of 8 meters per second. And the frequency is given as 6 into 10 to the power of 14 seconds inverse. So this is the given value. So once you do the calculation, you will be arriving at the final wavelength. So wavelength is expressed in terms of meters. Suppose you, in some cases, the question will be determine the wavelength in nanometers or Armstrongs. So that way you have to again go back and proper conversion, you should apply that. And 1 nanometer is equal to 10 Armstrongs. And you should be little mathematically strong to do this also. So the final answer is 5 nanometer, which is nothing but a wavelength. So next is how to find the wave number. Okay, so wave number you are asked to find out provided wavelength is given. So wavelength, you know that it is related inversely to that of the wave number. So lambda is equal to 1 divided by the, or you can calculate wave number by this formula, right? This is the one which is the relationship So you have to remember this one. Lambda is inversely proportional to frequency as well as it is inversely proportional to wave number. But wave number and wave frequency are directly proportional, right? They're directly proportional, but they're inversely proportional to lambda. So this is the basic fundamentals you should know. And once you substitute 1 by 5.89 10 to the power of minus 5 centimeter, how is 10 to the power of minus 5 centimeter? The question it is 10 to the power of minus 7 meter, because you know that the unit of wave number is centimeter inverse. In the terminologies I have shown you, right? It is used in IR spectroscopy. So 10 to the power of minus 7 meter, first let us convert into centimeters. So it is 10 to the power of minus 5 centimeter, and that is incorporated here. And when you divide 1 by 5.89, you get this. And 10 to the power of minus 5, when it goes up to the numerator, 10 to the power of 5 and centimeter as inverse as instead of centimeter. So the final is like this, right? So that's how you can calculate the wave number when wavelength is given using the formula wave number is equal to 1 by lambda. So this is the mathematical concept. When you go from higher value to lower value, you have to multiply. When you go from low to high value, you have to divide it. So that concept you should know. And this is the real-time formulas as far as spectroscopy is concerned. You should know the formula to calculate absorbance, and you should know the formula to calculate percentage T or T. And this is A is equal to 2 minus log percentage T. So these formulas you should be really able to recall during the exams to undergo your sums. So this formula, I'm not going to read the questions. The PPT will be shared to you. You can leisurely read at your convenient time. So 280 nanometer is nothing but the lambda given, and 1 millimeter is nothing but the path length, and 0.5 millimoles per liter is nothing but the concentration, and 54% is nothing but the percentage transmitted. So these are the values that is given. And what you're asked to find out, you're asked to find out the absorbance as one part, and also you're asked to find out molar absorption coefficient. So 2 tasks from this question. So first you have to categorize what all is given. Just I've shown what all is given there. So the thickness is 1 millimeter. I tried to convert it into centimeters because you always express the path length or thickness in terms of centimeters. And concentration is in millimoles per liter. So again, you can convert into moles per liter. And percentage transmittance, that is 54%, you can convert it to as a 54 by 100 as 0.54 as transmittance value. 54% is percentage transmittance. So you can convert into transmittance now. So what is the first task asked? Calculate the absorbance. The second task is molar absorptivity. So the absorbance, you can use this formula. A is equal to minus log T. And you know the value of log T 0.54. And by using a log book, you can arrive at the answers. So the first task is over. You found out the absorbance. Provided as a learner, as a student, you should know the formula A is equal to minus log T. And the second task is you have to calculate the epsilon, which is a constant absorptivity value, or A. So A is equal to ABC, you know. You can express as A or epsilon. So A by BC. So what is the absorbance that is given? You have calculated from the first task, that is 0.27, and thickness and also concentration. So once you calculate, you'll be arriving at the molar absorptivity. I said the formula is moles per liters per centimeter. And the third one is to calculate percentage T, provided you are given with absorbance value. So absorbance value is given, you have to calculate percentage T. So you know the formula A is equal to 2 minus log percentage T, right? So let us make use of that formula. And we hope that another formula also you can use here for simply, because percentage of T of a solution is asked to find out, and you can make use of this formula. So T is equal to antilog of minus A. So absorbance is given. So antilog of minus absorbance is T. And you want to convert T to percentage T, simply you have to multiply with 100. Okay. So once, if you are able to recall the right formula, even you can work out with this formula also. Why you cannot work out with this formula? When the question is that your percentage T is given and you are asked to calculate the absorbance, you can use this formula. But the question is, you are asked to calculate the percentage T, provided the absorbance is given. So you have to go with this formula. Absorbance itself, we have 2-3 formulas. So you have to know where you have to apply it properly based on the given terms from the questions. And this is very important sum. Even you can see in the GPAT either in Pearson or any other equivalent books. So concentration in terms of microgram level. So the question insists that you have to finally arrive at microgram per ml value of concentration, which you have to find out. So, and here molar absorptivity value is given, lambda is given, we are not going to use lambda anyway. Molecular weight is given, absorbance is given, and path length is given. So these are the various given parameters: absorbance, path length, Emax, molecular weight. So first let us calculate Emax with the formula A into molecular weight divided by 10. And if you substitute the values, you will be arriving at this A, small a. So once you arrive at small a, you can use this formula where your main interest is to calculate the concentration. So C is equal to A by AB. So absorbance is given. Yes, you are available with that. A, it is not available in the question, but I tried doing it with the other parameters. Of course, B is also available, right? So with this, you can take this formula. So C is equal to A by AB, substitute the respective parameters, and you arrive at the result gram per 100 ml. Why you arrive at the result gram per 100 ml? Because you have used a small a value. Small a is nothing but specific absorbance, right? Specific absorbance is nothing but A 1% 1 centimeter. A 1% 1 centimeter is nothing but 1 gram in 100 ml. So that's why you arrive at the answer gram per 100 ml. But the question strictly says that you have to report your answer in microgram per ml. So you can subsequently incorporate the numericals, that is 10 to the power of 6 by 10 to the power of 2, because this is 10 to the power of 2. So if you incorporate this, you can convert gram to milligram, 1,000, and milligram to microgram with another 1,000. So 10 to the power of 3 into 10 to the power of 3. That's why that is 10 to the power of 6. Okay. So next is here you have to find out the specific absorbance. Molecular weight is given, epsilon is given. So this is a simple formula which already we discussed. You can incorporate, and you should keep the unit as gram per 100 ml, or you can have deciliters per gram per centimeter inverse. Any unit you can incorporate. Yeah, this is the question which I was talking about in the previous cases. So here your percentage transmittance is given, right, as 32. There you are asked to find out the absorbance. So in this case, you have to use 2 minus log percentage T. Okay, to summarize this calculation part, as a learner, as a student appearing for competitive exam, you should know the relationship of Einstein equation. E is equal to h nu, h is Planck's constant, and nu is frequency, E is energy. And you can relate nu with C by lambda, lambda with also C by nu, or nu bar is equal to 1 by lambda, nu or nu bar. And you should know what is transmittance, what is 1 by transmittance, what is absorbance formula, all this formula, how to convert percentage transmittance T into 100. And you should know this A is equal to ABC according to Beer's law. A is specific absorbance, E is molar absorptivity. And also you should recall this formula to calculate molar absorptivity and concentration by A by AB. So always remember this quote, that when you want to convert higher to lower, you have to multiply. Higher to lower, multiply. Hydrolysis loss of molecule, HLM. Higher to lower is multiply. Hydrolysis is loss of molecule, you all can agree. And lower to higher, you have to divide. Lower to higher, it is division. Loss of hydrogen is dehydrogenation, LHD. LHD is loss of hydrogen is dehydrogenation. Anyway, lower to higher is division, higher to lower is multiplications. Apart from that, you should know how to convert electron-volts to joules, and what is Planck's constant value, what is velocity of light, how to convert 1 nanometer to meters, and what is Avogadro numbers. So these Avogadro numbers and joules, electron-volts helpful when you're asked to calculate energy. That problem I have not included in the slides, but you can refer books for the same. So that these are the summary in which you've done also. And to just add another 5-10 minutes from the book, the Pearson book, what all is important you should see. So you should aware of the wavelength range. You can divide the UV into near UV and far UV, and what is UV and what is far UV or vacuum UV. So this wave length range is important to be known. Even of course, other spectroscopy is also listed. You do have in your syllabus. Being this session is UV spectroscopy, I have highlighted only that part. And what is the sample cell is made up of? UV means it is quartz. Visible means it may be, it is glass. And what are the radiation source? You should be thorough. For UV, hydrogen discharge lamp, deuterium discharge, xenon arc, even mercury lamps also you can add here. Mercury vapor lamps. And visible, you have tungsten and carbon arc lamp. And these are the various detectors that is employed in both UV as well as visible. And calibration, I could see in GPAT syllabus, there is one particular topic on calibration of instruments where spectrophotometric calibration, how it happens. It is calibrated for various parameters using a standard reference material. Our SRM stands for standard reference material. So what are the parameters? You check for absorbance, path length, resolution, stray light, wavelength, and in the question paper, there was one odd choice, transmitted light. So all the parameters are checked for during the calibration of spectrophotometer except. So the exception is transmitted light. So these are the parameters are really checked for checking the performance of any spectrophotometers during calibration process. So for absorbance, they use potassium dichromate, path length using a quartz pair of matched pairs of quartz cells, and toluene is used for resolution, potassium iodide, and holmium oxide for wavelength, and potassium iodide for stray light. So these are the parameters. So please have a note that what are the parameters checked and using what standards that is being checked. And I'm not going to detail the calibration unless otherwise it is required for today's session. And this is some other questions I've taken from Pearson books to just quickly revise you. The following light, all these light plays a very important role in our syllabus. UV, you have infrared, you have radio waves, is nothing that it talks about NMR spectroscopy, and sunlight is a natural source, but the option is infrared rays, because infrared rays will have a tendency to capture the light from the heat sources and they spread into the environment, rooms or any kind of environmental places. So the answer is infrared rays. The light used in stress conditions, which means it is during the stability studies, especially to check the compatibility in the pre-formulations, and the UV range of 254 and 366 is generally employed. So I'm really, I look forward for the students to give your answers in the chat. I could not simultaneously see the chat, but I know sir is helping me. Since it's short of time, I'm not taking answers from you. Sorry for that. But you can work out yourself even in a convenient time. So next is mercury lamp. Just now I added in the previous slide. You all can, I just go back and show you why I added specifically, because mercury vapor lamp is not here in the list, but I added. See, the question is there. Mercury lamp is used as a source in which spectroscopy. So you have to choose this UV visible spectroscopy. Which of the following compounds shows peak in vacuum UV region? Vacuum UV region is below 200, right? So below 200 means 125, 135. So for this, the student should have knowledge in electronic transitions, what I discussed, sigma to sigma star, pi to pi star, n to pi. So sigma to sigma star is the one where solvents, other vacuums, your saturated alkanes like methane, ethane, all those things will have absorption over there. So you have to choose methane as a choice. So when UV light falls on a molecule, it causes what type of excitation? I said different types of electrons involved. So electronic transition happens. So the answer is D here. And so when you want to detect compound without chromophores, I said chromophores are very important for having absorption in the UV or visible light, but you don't have chromophores, but there's a choice of converting the chromophores into a non-chromophoric group in the chromophoric group. So for that, you have to go for derivatization. So derivatization is the way by which you can convert the non-chromophoric into a chromophoric group. But you cannot do that by changing simply a solvent or a UV range. So that they are not optional for the correct answer. And this question, see, you have to recall the EMR spectrum, what I just about to start, no, the previous slide, the very beginning slide, I've shown the EMR spectrum. So where you can see visible in the center and you have UV here, and this side you have NMR, and before NMR you have IR, right? So now you have to relate. So ascending order of energy, I said the spectrum goes like this way in energy, increasing, and this way in wavelength, right? So this spectrum you should be able to recall, then only you can answer this kind of questions. So visible is in the center. I said the wavelength is decreased here, energy is increased to the left side, which means wavelength is decreased. So now the question is ascending order of energy. So energy is more for UV, right? So you have to put this answer. So UV is more, then IR is more, and the least is the NMR. The option D is the right one. So this is very general question. So since UV is involved here, I took this question. So following are the air pollution. So you should know volatile organic compounds, toxic metals, ozones are considered as air pollutions, but UV radiation is just electromagnetic radiation, but they are not air pollutants. And so here again, the energy produced in the UV region produces changes in the electronic energy. So remember, there is absorption of rotation and vibration, but that's very least extent in UV, because vibration energy absorption is favored in IR, right? Rotational energy is favored in case of microwave, like you have Raman spectrum and so on. So these two are exception. The electronic energy is the major energy which is accomplished or explored during the UV visible absorption. So when you say UV region, you have to pick electronic. When it is IR, then you have to simultaneously move towards the other options. So which wavelength of UV light provides maximum germicidal action? So this is one germicidal UV, that is a UVC. We can classify UV as A, B, and C layer. So this comes under C layer, and the wavelength is 253.7. So once it was asked in one of the years of question paper. The IR spectrum appears as a dip. So now you have to compare, because the question is comparing two different spectra, IR and visible. So students should have a knowledge to recall what is IR and what is UV. So UV is wavelength and absorbance, right? UV is wavelength and y-axis is, okay, y-axis is absorbance and x-axis is wavelength. Whereas in IR, so in IR you have, this is UV, so you have absorbance, whereas IR it is wave number, right? Wave number against percentage transmittance. So first thing that you have to do during a preparation when you are preparing for spectrum based, you list all the spectrum, UV, visible, IR, mass, NMR, and see what is x-axis, y-axis. Be thorough with that. Then IR, the question is why there is a dips, why your IR peaks are like this? That's the question, why it is inverted, whereas your UV visible peaks are upward. The reason is IR is plotted between percentage transmittance wave number, which is opposite to the parameters. Wave number is inversely proportional to wavelength. Transmittance is inverse of absorbance. That's why we have a dips in the curve. So you should know the spectrum to answer this question. So region of electromagnetic spectrum below 200, you can easily answer. It is a vacuum UV. So here, which are not following cannot be used as a source. So students should know what all can be used as a source. Then only you can rule out the odd one. So Nernst Glober is the source for IR spectroscopy, whereas tungsten, hydrogen, lamp, deuterium, and tungsten specifically used for visible. Here you have to classify again. Hydrogen and deuterium for UV. Xenon, mercury also you can add. Carbon lamp for visible. But the odd one is Nernst Glober, which is for IR source, which is the IR source. Okay. And the most commonly employed detector on liquid chromatography. This question is absolutely towards the chromatographic chapter, but why I took this question for discussion is you have a choice of UV detector, and UV detector is most commonly used detector and also found to be least least expensive to go with to start up their academic any performance or any basic researches. So it's the most commonly employed detector in the chromatographic techniques. But after separation, you have to detect. No, for that, UV detectors are employed. So I just wanted to add 3 questions from the last year question paper. Sir, another 5 minutes can I take, sir? Quickly, I'll wind up. Hello, sir.
Yes, ma'am. Go ahead, ma'am.
So, okay. So this question, this exactly you could have seen before this question, not question, my discussion towards the calibration of spectrophotometer. So you can see the various parameters listed here: controller of wavelength, controller of absorbance, resolution, transmitter light, slit width. So in the discussion, I said wavelength should be checked as a parameter, absorbance to be checked. Sorry. Absorbance to be checked, and you have to check the resolution, you have to check the slit width, but there is no parameter checking towards the transmitted radiation. So what could be your answer? A, B, C, and E. So your option should be 2. So that's how you have to interpret and pick out the odd one out. So this is the last year question. So you should not think this time it will not be asked. It may be asked also in a different context, or they may twist and ask you. You may expect what kind of reference standard reference material can be employed for calibrating the parameter of wavelength, parameter of absorbance. So you have to know that potassium dichromate, holmium oxide. So the wavelength at which maximum absorption of radiation takes place. This is the terminology. Once if you know to define the lambda max, you could be able to answer this question easily. It's the very easiest question as far as concerned. And this question is a sum which has been asked in the last year. So the answer is 24.75. So here you have two drugs, that is ephedrine hydrochloride and chloroprazole, which absorption at 257 and 279. And they have given the values, that is A 1% 1 centimeter value for ephedrine as 9 and that is 0 at 2 different nanometers. So ephedrine 9 at 257 and 0 at 279, right? But the question is, you are asked to calculate the concentration. So you have to arrive, or finally you have to report the concentration of ephedrine hydrochloride injection. And dilution also given, it is 25 times diluted with water. And absorbance is given as for 0.424 and 0.972 at 2 different wavelengths. This is a complicated question. And this question you can see in working out when a student follows Beckett and Stenlack book for analysis preparation. So these are the given parameters. Ephedrine hydrochloride 9, that is A1% 1 centimeter value at 257 nanometer, and 279 it is 0. And chlorocrazole it is 20 and 105 respective wavelength. So these are the given parameters. Apart from that, they says that it is diluted 25 times, and also the absorbance value is given, right? So these are the given parameters. So first step, what we have to do is at 279, the absorptivity is 0, right? For ephedrine. So we have to use this formula. What is this formula? A 0.424 is nothing but A. A is equal to, so you can see there is 105. 105 is nothing but the A 1% or A, B, C. So you have to first start with the formula. A is equal to ABC. So where capital A stands for absorbance value, small a stands for absorptivity value, right? Absorptivity means specific absorbance value. So B is thickness and C is concentration. So once if you incorporate the values here, at 279, you can see the A 1% 1 centimeter value is 105 and thickness is 1. And concentration we have determined now, right? At 279. Now you have to calculate the concentration after dilution. So dilution is 25 times. So when you multiply it with 25 times, you get the concentration as 1.01 milligram per ml. So you converted gram to milligram. So your decimals varied here. So now you have the concentration of chlorocrazole is determined. But your question is, you have to arrive at the concentration of ephedrine. So let us find out the absorbance of chlorocrazole. Now A is equal to, same formula, let us apply. A is equal to, A is 20. Small a is 20 for chlorocrazole. 1 is thickness, and concentration what we already predicted for chlorocrazole. So first step, you have predicted the concentration of chlorocrazole and incorporated the concentration to arrive at the absorbance of chlorocrazole at the another wavelength, 257 nanometer, right? So now we have arrived at the concentration, the absorbance of chlorocrazole. This is absorbance of chlorocrazole, right? Now we have to move on to our interest to arrive at the final answer. What is that? You have to calculate the concentration of ephedrine. So the corrected absorbance, because chlorocrazole is another drug which is interfering, you have to mask the interference due to that drug. So that drug has absorbance of 0.081, which is subtracted from the absorbance of ephedrine, that is 0.972 at 257 nanometer. So when you subtract, you get 0.891. So that is nothing but absorbance. So A is equal to ABC, same formula. Always you should incorporate. So A is nothing but the corrected absorbance 0.891, which is equal to small a is nothing but the 9, which is the A 1% 1 centimeter value for ephedrine at 257 nanometer is 9 into 1 into concentration. So concentration will become, get the value of 0.099 gram per 100 ml. And when you multiply it with 25 times, that is applying the dilution factor, you finally get the answer 24.75 gram per ml. So that is what actually milligram per ml is the answer which is expected to be arrived. So I also recommend the students to take up this particular book, provided if it is available in your college library, or if you want, we can give the link for the same. So I try to collect few questions with the page numbers I've listed here. This can be a homework for today. So you can just refer the book, take up the questions. All these questions are related to UV visible, and you can work out onto that as homework part. And these are the references which, and you can better go and refer this Pearson guide also, and the link I've given below. So you can copy and paste the link, this URL into the Google. The book will open online. You can have for your reference. And also I utilize some of the slides from the Coursera, which is online course on spectroscopy, especially for the problems which I've attempted today. And these are all my own questions, which I generally used to give for my students during my lectures. So these are all Google Forms. So my request to the learners, so you can just copy one Google, so simply you can copy this like this and open the Google. I've given the access, so you can just go to Google. And you can paste the URL. So this Google form will open, and you can see here the questions. You can just answer these questions related to my discussion today. So likewise, after you submit, you get a score, and even you can view the score with the right answers also. So it's a kind of exercise, you can make it out, but please don't fail to attempt it today or at your convenient time. So nothing is impossible. The word itself says I'm possible. So I wish you all the buddies a great success, and all should get passed in your GPAT exam. That's our real intention as a teacher. But don't forget to work out on Woodward-Fisher rules. So because many questions has been raised every time in the question paper. So many thanks to IPGA and Alumni Association MNC, and also organizing coordinator for today's session, Mr. Malakanan sir and Dr. Uma ma'am and Dr. Jayakumari ma'am for giving me this opportunity. Thank you one and all.
Thank you, ma'am. It was an elaborate session for the students. I hope the students make the best use of this.
Thank you, madam. Thank you.
Thank you, sir.
Thank you, ma'am. Thanks for your time. I think we can wind up the session for today.
I'm very sorry. In between, there is some disturbances in
No
my
problem,
sharing.
ma'am. No problem. It happens.
Thank you, ma'am. A lot, ma'am.
Okay. Thank you. Thank you all of you. Thank you.
Thank you so much, ma'am. Thanks to the students as well. We'll see you again next week. All right. Bye-bye. Kanan sir, thanks.
Thank you very much, sir.
Oh, Kanan sir, are you there? I'm sorry, I did not see you. Thank you, Kanan sir. Madam, I could
Thank
see
you.
Meenakshi ma'am.
Thank you. Thank you, madam.
Thank you, sir. Thank you for your time. You are based in Porur, ma'am?
I work in Ramchandra, ma'am. I stay in Valsavakam. Porur.
Okay, okay. Good, ma'am. Nice.
Thank
Thank
you,
you,
ma'am.
ma'am. We'll stay in touch. Bye-bye.
Thank you, sir. Thank you, sir. Malakanan sir, thank you.